Body who does medicine. First presented ASM a couple of years ago at age 20, and now at the ripe old age of 22, he's looking forward to incorporating this into future medical practice. No one say a word to him for the first 10 years, right? Just let him work this out himself. His areas of interest are genetic medicine, stem cell technologies, and work on the nexus of clinical practice. And I am busting to hear this one, Viagra, an erection that changed direction. I'm hoping that there's a whole new reason that I can ask for this from my chemist friends. So welcome, Gal.
Okay. Good afternoon, everyone. It's wonderful to be back here in Melbourne again. Being at these conferences reminds me every year that it's such a wonderful time to be alive and such a wonderful time to be in the area of health and to be in the area of medicine. Yesterday we had a talk about drugs that can literally turn back time, turn back our cellular clock. We've had talks from wonderful people that are explaining to us medical advances that we couldn't even begin to imagine just 10 years ago. So I'm really proud to be a member of A5M and to have the opportunity to be able to bring something a little bit different and a little bit more quirky, perhaps, to your attention this year. So the name of my talk is Viagra, an erection that changed direction. Now, there's probably many among us here in the audience that have been prescribing this drug for close to 20 years now. Viagra was approved in the year 1998 by the FDA, and while we would all imagine that this is just a drug for erectile dysfunction, what we're actually finding is that this drug could actually revolutionize the way we think about preventative medicine and the way we think about anti-aging medicine. Now, from the get-go, I want to make it clear. I'm not an expert in cardiology, urology, or drug design. But what I am is a curious person. And during my experience in general practice rotation, spending time with patients on the hospital ward rounds, I encountered many male patients that, thinking about it and taking the time to reflect, I had to investigate further. And the connections that I found were staggering. So we'd all be familiar with the drug aspirin. Aspirin has been around for a long time, and it's an incredibly versatile drug. But what if I told you that Viagra, the magic blue pill that many of you have probably been prescribing now for close to 20 years, could hold the same promise? So there's three big players when it comes to Viagra, and these are called the Pde5 inhibitors. We've got sildenafil, vardenafil, and tadalafil. That last one, tadalafil, Cialis, is the longer-acting drug, and that came out in 2003. So briefly, let's compare these three big players. All of them share some common side effects. These include things like lowering of our blood pressure, headache, and facial flushing. And unique to Viagra is the visual changes or blue vision that we sometimes get. So I've given some quiet, big statements here about Viagra, and you're probably all thinking, what's the big fuss? I mean, Viagra is a drug that improves blood flow to the penis. We get better erection. What's the big deal? What is this kid on about? So I want to give you a brief snapshot of just some of the media attention. And this is only very recent articles and only really scratches the surface. Viagra could soon be used for heart disease patients, pulmonary hypertension. Long considered a threat, Viagra may help treat heart disease. FDA highlight Viagra appears to be cardioprotective. Alzheimer's Society could be used for dementia, diabetic neuropathy, and even malaria. How fascinating is that? A drug for erectile dysfunction could hold promise for the disease malaria. So let's have a bit of a look at the history of this really fascinating drug. So before it came to be known as Viagra, it was known as UK 92480, fastest selling drug of all time, Viagra. Now, believe it or not, this drug was originally studied for high blood pressure and angina, that's chest pain. What they found is that it was actually ineffective for this, but what we have now is potentially the most profitable in human history accidental discovery ever made. And that accidental discovery, I'll try to make as subtle as possible there. It's improved erection. And the FDA then approved the drug for treating erection in 1998. Sales of close to $200 million in just the first 2 months. I don't know any other drug around that time that even came close to those numbers. So the biochemistry, while this may look like a complicated diagram, it's really not as hard as it looks. Without going into too much detail, because we're short on time here, Viagra enhances erection because it allows improved blood flow. To illustrate that a little bit more clearly, the overall effect of Viagra is to relax our blood vessels. And I just wanted to mention an important point here. When we relax our blood vessels, we're essentially allowing erection to take place via the basic physics concepts of hydraulics, which I'm sure you'd all be aware of. So it's important to mention here that when our blood vessels relax, more blood comes in, the penis engorges with blood. Overall, we have a reduction in blood pressure. For your patients that are already on Viagra, if they're already taking other drugs that may lower blood pressure, it's important to be aware of this because it can be fatal if they have a collapse, if they fall. The danger is really from the traumatic injury that would come from the fall. So a look now at the anatomy. This is as hard as it gets. So the penis has a blood supply, it has a nerve supply, and it has a spongy tissue in the center, and that is known as the corpus cavernosum. It's very similar to our nasal sinuses, and in fact, under the microscope, it's very difficult to tell this apart from the sinus tissue in our nasal sinuses. The helicine arteries of the penis, of the corpus cavernosum, are very important in terms of erection. So that's a little bit of the basic fundamentals, and you're probably all wondering now, where is the science? Why is Viagra potentially going to change preventative medicine and anti-aging? Well, this is a really beautiful diagram which I've adapted from experimental clinical cardiology, and it talks about things like cardiomyopathy, myocardial infarction, neurodegenerative diseases, connective tissue disorders, vascular endothelial dysfunction, and even things like fetal growth restriction. Cardiovascular disease is a massive problem in Australia. It affects close to 4 million of us, kills a person every 12 minutes. Every 9 minutes, one of us is going to have a heart attack. Now, what's the big, scary thing here? Erectile dysfunction may be the first and only sign of cardiovascular disease in otherwise healthy patients. Now, looking into this further, what we have is a penis-heart connection. Having severe erectile dysfunction is a huge risk for hospitalizations. It's a massive increased risk of death. When we then combine this with men that had coexisting heart disease, look at these staggering statistics. Risk of death up by 137%. So what we have here is a really deadly, dangerous combination. So erectile dysfunction is important for us to recognize as people in the health profession because it may be the only sign of underlying cardiovascular disease. The risk factors are the same: obesity, diabetes, high blood pressure. Really, at its crux, what we're talking about here is the metabolic syndrome. Erectile dysfunction has many causes. I don't want to make out like it's all vascular or cardiovascular in origin. Aging itself is an independent risk factor, and something that I really wanted to bring up was environmental and lifestyle choices. Your patients could be taking an overdose of Viagra, but if they're continuing to smoke, drink excessive amounts of alcohol, and still take drugs, it's not going to reach its full potential. So why is it important to talk about these things? Well, it's important to talk about because part of a healthy lifestyle is a healthy sex life and a healthy cardiovascular system. Reiterating what many of us have already spoken about already, it's about prediction, screening and planning, and the ultimate aim of anti-aging medicine, as we all know, is about prevention. So Viagra was first tested in rabbits, and I've got here an image of Duracell Viagra, lasts longer, much longer. And I know we're short on time, so I won't go too far into the detail, but Viagra has been found to be cardioprotective in rabbits. These studies were then repeated in mice and rats, and a really fascinating discovery was made in the cardiac myocytes of mice. Not only was Viagra cardioprotective for the heart, it actually prevented cell death. It prevented necrosis and apoptosis of the heart cells. Now, isn't that just unbelievable? So it's fine and dandy to have all of these animal models. I mean, there's dozens of them, and I've only scratched the surface and shown you a select few here. So the question is, what about humans? How can Viagra help men with heart disease? Well, we have a number of studies that show that sildenafil improves hemodynamics in people with heart failure. And there's a number of studies like this, improved oxygen uptake. And here's a really interesting review from the Journal of Congestive Heart Failure. And it says that Viagra is emerging as a novel approach, a new approach in the therapeutic management of heart failure. Is Viagra the silver bullet for heart failure and cardiovascular disease? The answer is no. Systolic heart failure is a vastly different pathophysiology to that of diastolic heart failure, and the existing drugs for diastolic heart failure aren't even that great. Here's a trial that was done at Duke University led by Margaret Redfield called the RELAX trial. What they found, Viagra no more effective than placebo for diastolic heart failure. Now, moving on from the heart and moving to the brain and the spinal cord and our nerves, neuroprotection. Viagra can improve cerebral oxygenation, improve blood flow to the brain, and by doing so, improved oxygen and nutrients. This has been shown in a number of studies, improved vascular function in the brain in patients with pulmonary hypertension. And moving on to some more interesting and perhaps unusual applications of this incredible drug, fetal growth restriction. So some pregnancies are compromised by fetal growth restriction, and there's issues with uteroplacental blood flow. So emerging research is showing that this may be so valuable in obstetrics and gynecology, this field of medicine, by improving blood flow in this uteroplacental circulation. Raynaud's phenomena is a type of connective tissue disease. Viagra has been found to be incredibly useful in improving peripheral blood flow and improving the clinical symptomatology of a large subset of patients with this condition. So future developments. Viagra should continue to be investigated. It's an incredible drug, and a lot still is unknown about how it works. Now, are there any things that we should worry about? I mean, from what I've spoken about now, Viagra sounds like a miracle drug. But there are some things to be aware of. Last year in 2014, a study came out, and this study showed that there may be an association between Viagra and melanoma, and potentially malignant melanoma is the one that they were worried about. So until recently, it's unknown. It's been unknown. Is this a causal association? The more Viagra you take, is that meaning that you're more likely to develop melanoma? And the answer is still not 100% complete, but it's looking like it's not a causal relationship. So a study was done by Stacy Loeb in the US, and what they found was that there's a lack of association with multiple filled prescriptions and the risk of developing melanoma, raising questions, is this really causal? So what it seems to be the case at the moment, it's not Viagra that is potentially causing the melanoma, but more the Viagra lifestyle. And in many respects, this sort of seems intuitive, it seems common sense and obvious. If you're a man and you've been suffering from erectile dysfunction and you're now able to get erections, it's giving you a new lease on life. You're probably going to have an improved mood because your sex life is better. You're more likely to go out. You're more likely to meet women. You're more likely to have fun. And you're more likely to spend more time in the sun. Now, something a little bit different and a little bit off topic. Very recently, in June of this year, a drug which is now being touted as the female Viagra was approved by the FDA. Now, this drug has been around for quite some time, but only recently has the company, Sprout Pharmaceuticals, actually been able to gain approval. It's used as a non-hormonal treatment, especially in premenopausal women with a condition known as hypoactive sexual dysfunction disorder. Yes, it's a real condition, and this drug was approved to treat it by the FDA with a vote of 18-6. So this is the company, Sprout Pharmaceuticals. And how does this drug work? Very, very differently to the drug Viagra used to treat erectile dysfunction in men. A crude description, but one that I feel is quite apt. It's almost like an antidepressant for the ovaries. This isn't improving blood supply to the pelvic organs. It's treating a completely different condition, one which has its basis in the brain rather than in the vasculature or the pathophysiology of the nerves and blood supply to the penis. This is used to treat really a syndrome unique to women. What this drug does, rather than act on blood vessels and improve blood supply, it works on neurotransmitters, serotonin, dopamine, and norepinephrine, and it achieves a better brain soup. What it does is it improves the balance of these neurotransmitters in the brain, and it's been shown to be quite effective in premenopausal women with hypoactive sexual desire. So in summary, a healthy lifestyle means a healthy sex life and a healthy cardiovascular system. When we're aware of these new innovations and what is happening in medicine at the forefront, at the cutting edge, we support the process of prediction, screening, planning, and ultimately, we're promoting prevention, longevity, and increasing our patients' quality of life. The risk factors for erectile dysfunction are the same as those for heart disease. And at its crux, we're really talking about the metabolic syndrome here. So for everyone in the audience, if you can take away one thing from my presentation today, what I'd like you to take away is that the next time you see a patient that comes in with erectile dysfunction and you've taken his history, you've done the physical examination, you're thinking to yourself, this is just another patient with erectile dysfunction. I want you to all take a moment to reflect and think, is this a heart patient that's masquerading as a patient with erectile dysfunction. And I also think it's very important to understand that Viagra's role as a versatile pharmaceutical, this is just the beginning. There's so much more to be explored, and the studies available right now are only really scratching the surface. Cardioprotection is just the beginning, and there's even research looking now whether Viagra may be useful to treat some very specific subtypes of cancer. So before I finish off, I'm sure every male and their wives and girlfriends here will appreciate this. It's a brain telling his heart and his penis. I hate when you guys make me look like an idiot. It's happened many times in my life. And if you'd like to ask me any questions, feel free to do so during our breaks. And I just thought I'd put together a funny image here of the male brain versus the female brain. You'll see that the male brain has a commitment neuron and a huge area dedicated to sex. Surprise, surprise. We've also got an ogling center, power tools lobe, and job stuff. And the female brain has a large shopping lobe and one neuron for logical argument. Hope I haven't offended anyone. It was just a joke. We've also got the fantasy and emotional blackmail system, maternal urges, weddings, and flowers. It's seeming pretty accurate. And I guess I'll end it there before I offend any more people.
Stay there.
Okay.
Do not get to move.
Okay.
You're 5 minutes short. So I'm sure that there's a question or two from the audience. The first one for me is this lifestyle thing that when you get erections, you spend more time outdoors naked or something like that rather than in clubs and undercovers. I'm fascinated about your thought about what better erections makes you do.
Yep. So there's yet to be
outdoor sex, obviously.
Yep.
Yes.
There's yet to be a rigorous study which is looking at. Did I miss something?
No, just a rigorous study.
Okay.
A thought.
Okay. My bad. Yeah. So there's yet to be a rigorous study which is looking at the lifestyle choices of men that use Viagra compared to others.
But that's called an observational trial.
Yeah.
Yes.
So yes. So
We
there's.
like looking.
Yeah, so that's an area that needs to be looked at least looking at what evidence is available from these studies. It's not looking like Viagra is the culprit, but more the other lifestyle choices or other things that we're not 100% aware of that are contributing to it.
Okay, any other questions here before we all race out? Yes, up there.
Is there any equivalence to using a small dose, slow release? Viagra comes as 25, 50 and 100.
Mm-hmm.
If you made a 1 milligram or a 5 milligram slow release, do you see heart benefits in that?
To be honest with you, the doses of Viagra between the different studies have been different, but the central motif is that all the studies have used, for the most part, Viagra. There are, I guess, the long-acting phosphodiesterase 5 inhibitors like Cialis. Whether low-dose Viagra, as you suggest, may have the same benefit, I don't know because I haven't seen a study that speaks about it specifically, but it could likely potentially be an option.
Jonathan?
Are there any studies that have looked at these different functions with the other medications such as Cialis to show whether it's a class effect or specific?
Mm-hmm. Again, most of the studies are Viagra. There are a very, very limited number of studies looking at the other drugs like Cialis. To be honest, from the ones I've seen, I didn't really want to speak about them too much because the sizes of the cohorts weren't as big as a lot of these studies. But there are studies out there, and if you'd like, I can send you a copy after the talk.
Did Pfizer buy your stethoscopes for you and
No.
compromise you in any way before this talk?
No, they did not.
That's surprising.
I wish. I'm a poor student. It would help.
All right. And the dosages for these benefits in women is unknown at the present. Is that what you'd be saying?
I was speaking to someone earlier about this. Viagra in women, in my opinion, is shamefully understudied. But if you go online and you read a lot of anecdotal reports from women, what we see is that a lot of women are actually reporting improved cognition. They're reporting things like improvements in their mood. Again, this is just people's reports online. It hasn't been corroborated by any studies of significance that I've seen, but it is something to consider. In terms of sexual function, again, there are, if you go online, there are a number of women on forums that are providing anecdotes that it may improve their libido, may improve their sexual drive. Again, I haven't seen any studies of significance that corroborate this with any scientific rigor behind them.
Okay.